Hi, I'm Tatiana Falcone, a child psychiatrist here at Cleveland Clinic Epilepsy Center. Welcome to a series of webinars targeting educational topics for parents of children with epilepsy. We assemble a great team of doctors, psychologists, nurses, social workers, parents, patients with epilepsy, and epilepsy educators to help you navigate all the different challenges that epilepsy may present. Project Care for Epilepsy is designed to improve care coordination, increase social support, provide education, and increase engagement for teens with epilepsy and their families. This project is supported by the Health Resources Services Administration of the U.S. Department of Health and Human Services. The information, content, and conclusions presented here are those of the authors and are not the official position or policy of HRSA, Health and Human Services, or the U.S. government. At the end of each webinar, there will be a link to answer 4 questions about the new topic you just learned about. Please take a moment to answer this quick survey. It will help us understand your needs better. The Cleveland Clinic Epilepsy Center welcomes and thank you for your participation in this educational series.
Hello, and welcome to our webinar on anxiety and epilepsy. My name is Dr. Jane Timmons-Mitchell. I'm a child clinical psychologist, and I work here at the Cleveland Clinic as part of a HRSA grant on epilepsy. And I'm very glad that you've decided to spend some time with us this morning. When we think about anxiety, a good question to ask is, how many people are affected by anxiety in the general population? And we know that anxiety is a condition that affects about 18% of everyone, which is a lot of people, about 1 in 5. We all experience stress and sometimes fear, but in order for it to be called anxiety or an anxiety disorder, it has to last at least 6 months, and anxiety disorders can get worse if they're not treated, so it's really important to identify what they are. Among those 1 in 5 people, girls and women seem to experience more anxiety than do boys and men. And why would this be? One reason is because we think that girls and women are more invested in relationships, and they have stress in the parent-child relationship and also in friendships, where girls experience higher levels of friendship stress than do boys and men. What are some of the types of anxiety? You may be familiar with many of these, and they're all different types of anxiety. One type would be panic disorder. Panic disorder is pretty important to recognize and understand. Many times people will think that they're having a heart attack when in fact they're actually having a panic disorder. They have shortness of breath. They have tightness in their chest. They feel a lot of dread, and it's very important, and this often brings people to the emergency room to check out, and sometimes they're then relieved to find that they have an anxiety, a panic disorder, instead of actually a heart attack. Another type of anxiety is obsessive compulsive disorder. You might be familiar with this also. This, in the extreme, would be somebody who can't leave the house until they have turned off a light switch perhaps an even number of times, say 10 times. It has to do with checking to see whether you've done something that is distracting to you and whether you've done it appropriately or well enough. Another type of anxiety is post-traumatic stress disorder. And post-traumatic stress disorder is something that was first identified with people who had gone to war as early back as World War I, when it was called shell shock. Post-traumatic stress disorder became very well known after the Vietnam War, when a lot of work was done and it was named what it is now. And it's related to acute stress disorder. So this is a type of anxiety where if you've been in a life-threatening situation, you could experience a lot of anxiety either while it's going on, so that would be on the battlefield, but for a child could be something like being in a situation where they feel that they're trapped or are being disciplined excessively, and they feel that they can't get out. And then later on, re-experiencing the stress could come in things such as nightmares, stomach aches, things like that. Phobias are something that are pretty common, and whether it's actually a phobia that we would classify as an anxiety disorder or just something that somebody says, I'm really scared of this in a big way, is an important distinction to make. So some common phobias would be things like, many people are excessively afraid of spiders or snakes, or being in tight spaces, claustrophobia, or being on high buildings. So those are all things that are pretty common, but they can cause quite a lot of fear. Some people, and a lot of anxiety. Some people actually have anxiety about flying that is so pronounced that even in this day and age, they're not able to get on an airplane. And then finally, generalized anxiety disorder is where you feel anxious a lot of the time, and it may not be located in anything in particular, but it just is this feeling of being on edge and not being able to continue with your daily activities. So that's general anxiety. What about anxiety in children and youth with epilepsy? We know that anxiety often occurs in children who have recent onset epilepsy. And among people with epilepsy, among children with epilepsy, between 16 and 49% of children with epilepsy develop anxiety disorders, and about 20 to 40% of the time. So nearly half of all children and youth with epilepsy may have difficulty with anxiety. And that is why we're having this webinar, because it's something that's quite common, occurs to many children and youth with epilepsy, and something that we need to be aware of and be ready to watch for. Some new studies have been done. These are findings from Jana Jones at Indiana University, and she reports on some MRI findings. What she reports is that people who have anxiety disorders have particular abnormalities, particular types of abnormalities in their brain structures, and they can be seen early in the course of epilepsy. They're not related to the chronicity of the seizures, and they can be linked to a family history of anxiety. So if your child has epilepsy and there's a family history of anxiety, there may be a slight elevation of the possibility that the child will also have anxiety. What are some of the things that make it more likely in addition to the family history? One would be the severity of the seizures. Another is taking more than one anti-epileptic drug. Another would be the age of onset. And then another is the duration, how long the child has had epilepsy, and also the type of epilepsy. Why do children and youth with epilepsy have anxiety? Well, one of the reasons has to do with the general experiencing of epilepsy itself, that it's chronic and unpredictable. And for anyone, these are two features that can cause people to be anxious. If you don't know when something is happening, and if it's possibly going to happen all the time, and if there's an issue of whether it's under control or not, that's something that in general could make somebody very anxious, and it tends to do so for children and youth with epilepsy. Children with epilepsy often struggle to communicate their feelings effectively. Communication is something that can be a focal difficulty for children and youth with epilepsy, and what we have learned is that effective communication can lower anxiety. And so if you're somebody who's struggling with a chronic condition that's unpredictable and you have trouble communicating your feelings, that may be something that predisposes you to being more anxious. Sometimes kids who struggle to express their feelings have physical symptoms like headaches and stomach aches and back pain and nausea or vomiting. There, of course, are other causes for any of these symptoms, but these are things that are frequently associated with anxiety. So if you see a frequent and an ongoing pattern of one of these, it might be something to think about. How does anxiety look in children and youth with epilepsy? Anxiety may look different in children than it does in adults. This is for all children. Some of the warning signs for children include being argumentative, irritable, or aggressive, having angry outbursts, or destroying property. And those are two things that we don't often think about when we think about adults who are anxious. We think about if you're an adult and you're feeling anxious, chances are you might describe yourself as feeling on edge. You might also withdraw a bit in order to try to get yourself back on track. Whereas with children, these issues, which in adults can be sort of drawing inward, are often manifested as showing outward through the irritable, aggressive, or destroying property kinds of behaviors. Then we have the things that kids aren't able to do, like going to sleep, getting out of bed, going to school, because of worry about what will happen. That's pretty similar to how it might look in adults. Also, we might have kids avoiding activities that they like and or that they've engaged in recently. So anytime you see a kid withdrawing from activities that maybe a couple weeks ago they were good at and they liked a lot, then that should sort of send up a red flag. If you see kids talking about or showing fears, including things like spiders or heights, or being afraid of social situations. This could be that they might talk about it. You know, I'm afraid to go to the birthday party. I don't want to go to the birthday party because, you know, I just don't like it. It may not be that they just don't like it. It may be that they feel really uncomfortable and that it's going to make them feel more anxious. And finally, needing to check something over and over, like whether they left a light on. You may recognize from before that these are some special applications of the different kinds of anxiety that we were discussing. One form of anxiety that can affect kids with epilepsy predominantly is school refusal. And so we know that epilepsy can affect the way that children think. We call these cognitive abilities or thinking abilities. And these can decrease attention, comprehension, and school performance. So, as you know, a child or youth with epilepsy may be at risk for school performance that is not what it used to be or not what it could be. And possibly because of that, children might avoid or try to avoid school tasks. They might pretend to feel sick and refuse to go. Another reason that a child with epilepsy might think about or be showing school refusal, because of the severity of the epilepsy, a child will have to miss school. And sometimes they get behind. And for all kids, when they get behind in school, then it's harder to catch up, then it's harder to go, and it becomes a cycle. It's important to ask for help with the school to decrease the probability of school refusal, because that is one form of anxiety. And as we know, it is kind of like a snowball. Once it gets started, it kind of rolls downhill and gathers pace, and it's hard to stop. So it's important to try to be aware of it, look for it, and try to head it off as much as you can. Having a seizure is certainly a cause for anxiety, and if we think about tying this back to the school refusal, that could certainly be a reason that a child might not want to go to school. Of course, having a seizure can be really traumatic. When the seizure occurs during school or in a public place, a child or youth with epilepsy may feel very embarrassed, may feel out of control, and may want to avoid that situation, which gets back to not wanting to go or not wanting to be there. It may help to educate others about how to decrease or reduce the negative labeling about epilepsy, and it might help your child feel more comfortable to talk with them about how you've talked with other people about what should be done. But it is, again, something to keep an eye on, because we want to try to head off difficulties before they become so great that you and your child will have a very difficult time to get them righted. I'm going to talk a little bit about another aspect of anxiety that seems to be pretty unique to children and youth, and this has to do with involvement with social media. If you're a parent of a child, especially a teenager, you probably are very familiar with how much kids use social media. We know that about 73% of kids who go online are using social network sites. We also know that social media adds to stress because there's no break, there's constant comparison with peers, and because social network sites are worldwide, you're not only comparing with the kids in your class, which might have been true a generation or two ago, but you're comparing with all the peers worldwide, which is too much for anybody to process when they're a teenager. We know that girls spend more time on social network sites than boys do, and girls especially report that social network sites interfere with their daily lives more than boys do, including getting behind in schoolwork and losing sleep. And you could see how either one of these things could contribute to something like school refusal that we were just talking about. One of the more pernicious aspects of being on social network sites is cyberbullying. Bullying itself is difficult, and it affects kids with epilepsy. It affects all kids who are in some way different, unfortunately. But cyberbullying is something that is new because of social network sites. And so the kinds of cyberbullying that there are would include IM or instant message, email, somebody sending you an email in your email box, signing into chat rooms, visiting websites, online games, which can be good to promote social interaction, but they're also a place where somebody could be cyberbullied. Social networking sites like Facebook, I think Instagram is a newer one that people are working with, and text messaging. And how would cyberbullying manifest itself? Unfortunately, there have been some famous and reported cases at this point where people go on and send an anonymous instant message, put up a post on somebody's page, and these can be very damaging, and because they're anonymous, can be really detrimental. How prevalent is cyberbullying? We think about 20% of teens are involved in cyberbullying, either as bullies, victims, or bully victims. We don't often think about kids being bully victims, but that tends to be something that occurs after you've been a victim. You often will kind of say, well, I'm going to dish back some of what people have been doing to me. And it's a cycle that is predictive of some very bad long-term consequences. We know that more girls than boys report being cyberbullied, and this is kind of interesting. More girls than boys engage in cyberbullying, possibly because they're on the social network sites more and because they're victims more. The effects of cyberbullying can include feeling sadness, again, school absence or leaving school early, failing grades, anxiety, here's our topic again, health effects, depression, and in the extreme, suicidal ideation. Because again, I mean, this is something that somebody can do in the privacy of their own computer, and it's anonymous. And we think that that increases the likelihood that people will say and do things that they wouldn't do if people knew who was doing them. How do you know if your child is being cyberbullied? It's harder to detect than other bullying because it's anonymous and not done face-to-face. Regular bullying that happens in school is not a good thing, but most of the time somebody will see it happening and it can be reported or identified. Cyberbullying is much harder. It generally is not identified back to the person who actually engaged in it. And we know that girls who cyberbully, again, the bully victim and these people are now bullying, have higher rates of anxiety and depression than girls who bully in non-electronic ways. So this is a bad pattern that we want to try to help kids avoid getting into. What do we know about what we can do about anxiety? This part is going to be more focused on what are some of the solutions that you could seek out if you felt that your child was having difficulties with anxiety. So one of the really great things is that we have medications now that are effective for helping kids who have anxiety disorders. And if you think that your child has an anxiety disorder, it would be helpful to talk with your primary epilepsy provider to see if you can get a referral to a child psychiatrist, because a child psychiatrist is the person who you want to have your child see in order to explore whether any of these medications might be helpful. The treatment of anxiety disorders with medication involves SSRIs, which are selective serotonin reuptake inhibitors, and they've been shown to be effective for the treatment of anxiety disorders in children. So some of the medications that might be prescribed if your child sees a child psychiatrist include the common brand names of Prozac, Zoloft, Celexa, Lexapro, Paxil, and the common generic names fluoxetine, sertraline, citalopram, escitalopram, and paroxetine. What else can we do about treating anxiety? In addition to treatment with medication, talking therapies can be very helpful. Cognitive behavior therapy is actually a compendium of probably over 200 different elements of therapy at this point. And what happens in cognitive behavior therapy is that a cognitive behavior therapist can teach your child many things that can be helpful to reduce anxiety. Some of the things that you might work on if you saw a cognitive behavior therapist include deep breathing and muscle relaxation, decreasing thoughts that are self-defeating. So an example of that would be if you saw things as all black and white or thinking the worst about everything, disasterizing, a cognitive behavior therapist can help you to reduce that and to redirect those thoughts into more positive ways. Another thing that you can work on are new problem-solving skills. What you do is you learn how to substitute new problem-solving skills instead of the self-defeating thoughts. So every time you come up with a self-defeating thought, you would learn to substitute and switch to the new problem-solving skill that you're going to employ. You also would learn how to evaluate and change thoughts that are not supported by reality and that may get in the way. So what would be an example of this? Let's say that your child expresses to you that he or she can't go to school because they're having a test and he or she has not studied for the test, and therefore if the child goes to school, he will flunk the test, and that will be terrible because then he will flunk the year and the kids will make fun of him and the teacher will be mad at him and you will be mad at him. Okay, so that's a chain of disasterizing thoughts. And what the child and you as the parent would learn if you were working with a cognitive behavior therapist is how to evaluate that. To say, well, okay, if you go to school and you haven't studied for the test, perhaps you've been out and missed school because of your epilepsy, then one thing that you can do is to talk with the teacher, because we have a plan in place at the school that if you've missed school and you've missed work, that when you return to school, you won't automatically take the test that's being given that day, but instead you'll be given a chance to catch up on some of your work. And then an alternate arrangement will be made for taking the test and possibly an alternate way of taking the test. And that should give you a little bit more of a chance. It may not always fix the issue at hand, but it's a way of reconsidering it. And after you do that, every day and every situation that comes up hundreds of times, you begin to create new thought patterns that will be more adaptive and more helpful. Other things that you might address if you're working with a cognitive behavior therapist, you might learn how to recognize which feeling is which. This sounds pretty elementary, but for children, especially younger children, they're not used to naming their feelings, and even if they are used to naming them, not so much knowing what they do. And so remember before we talked about how children and youth with epilepsy have difficulty communicating their feelings. Well, it begins with knowing what the feeling is and how it's manifested. And so some specific targeted work would be devoted to that. If you've ever been to a therapist's office, you may see one of those charts that has about 100 feelings on it. And so they're like little smiley faces with different arrangements of the facial features to show each of the feelings. And part of what you begin to work on is a feeling vocabulary. Then you may make a plan to increase social and physical activity, because we know from a lot of research that people who have anxiety and depression do a lot better if they get up and get out and have what used to be recess, but it could be going to the gym, and have some kind of dedicated physical activity that gets built into the schedule. If it's a child, often the physical activity will be involved in some kind of a sports team, and then that brings with it social activity, so you kind of get two things at the same time. It may be difficult for kids with epilepsy to participate in sports, and there's certainly some sports that you would want to avoid, but there are others that can be okay, and so again, you may want to talk with your primary epilepsy provider about that. Another thing that can happen is to teach your child how to rate anxiety from 0 to 10, identifying things that cause fear or worry, and develop a plan to deal with them in small steps. And then again, to develop a plan to manage fears. Preparation is really helpful. You may find that whenever you take the time to prepare for something, you feel a lot better if you have to confront it. And sometimes just being prepared means that you don't have to confront it at all. That's often the case with anxiety. Another thing that you may want to do is to make a plan to communicate with everyone who works with your child. That's always very helpful. Communication among the members of your child's team is going to help to manage anxiety that your child sees, but also may reduce it in a preventive way. And then again, talking with the entire family so that everyone can communicate with your child in the same way. We were talking before about social media stress, and here are some specific steps about how to avoid social media stress, which again is important because we know that it's linked to anxiety. This is a list that was in the Huffington Post in 2013, and I think it's a really useful list, so you might want to just have it around to look at. The first element is, if you're going to use Facebook, use it to share, not to compare. So don't compare yourself to all of those thousands of other people that are on Facebook. Then the second part kind of goes with that. It's be careful not to overshare. We know that 39% of teens don't use the privacy settings at all, which means that anything that they put up there is there for the world, and they don't understand how detrimental that could potentially be. Another thing to help your child do is to say no to cyberbullying, so that if cyberbullying occurs, that they would tell a teacher or a parent. I recently heard that there's been an app developed to help decrease cyberbullying. It works at the school level, and schools can get licenses so that kids can take screenshots of an instance of cyberbullying and then upload it so that somebody at the school would know that that's happening. I think that's a very promising possible new technology. Another element is to be positive and use the golden rule. Very importantly, keep your love life offline. Keep your photos clean. So this part of that I think is very helpful, because teens don't have the perspective to know if they're going to use a filter, what the filter should be. So this is what I think is a good one. If you wouldn't want a college admissions officer or a future employer to see your photos, don't share them. And it may seem a little extreme, but we all know that there have been instances of people being denied employment because something from a college spring break surfaced on social media. And we do know that employers and now college admissions officers will check social media sites before offering employment or admission. So that is a real thing, and something that can be very helpful if you just, look at it ahead of time. Some more ways to avoid social media stress. Choose your friends wisely. And so by friending somebody on a social media site, use this criteria. Only allow people you really know. Research shows that the more anonymous friends you have, or people who kind of send a friend request and you've never heard of them and you don't have any friends in common, so somebody you yourself are not likely to know, the more anonymous friends you have, the greater anxiety there is and the more possibility for unintended consequences. And finally, and this one has some parts, take time to unplug and recharge offline. There is a Chrome plugin that will block logging into social media sites, and if teens don't consider using it themselves, it might be helpful as parents for you to consider using it, imposing it, suggesting it. But being offline and having some time not to be on screens is often a good idea. There is research that says that if kids are using more than 4 hours of screens, depression and anxiety That would be daily. Depression and anxiety are likely to increase. And so it's a simple thing to do. Just make sure they have some downtime. Finally, I just want to talk to you a little bit about learning some simple breathing techniques. You may remember that the first thing on the list of what you might do with a cognitive behavior therapist was to learn breathing and relaxation techniques. And so what's so great about breathing techniques is that if you just learn how to do these breathing techniques, they do increase relaxation, which combats anxiety pretty effectively. So there are two that I'm going to talk with you briefly about. The first is slow breathing. Slow breathing in the extreme is the kind of breathing that Buddhist monks do that slows down the heart rate to a point where it's almost undetectable. And in moderation, the kind that we can practice, we know that it has all kinds of wonderful health benefits, slowing heart rate, decreasing blood pressure, and those are the kinds of things that also will help you with decreasing anxiety. So for slow breathing, you need a way to time seconds. If you have a second hand on a watch or a digital stopwatch, you can say to yourself, 1 Mississippi, 2 Mississippi, as long as you don't get lost. That can sometimes be a difficulty. But however you're going to do it, you can just count into yourself 1, 2, 3, 4, 5, and then count out. You want to begin by breathing in on a 5 count and out on a 5 count. So you would go 1, 2, 3, 4, 5, out, 2, 3, 4, 5. And what you want to do is keep doing those repetitions, increasing your breathing so that you're breathing in on a 10 count and out on a 10 count consecutively for at least 2 minutes. If you're not used to doing this and you start out doing 10 on a side, you're going to hyperventilate and probably feel lightheaded and not good. But if you start small and build up, you can in fact slow down your breathing and get some health benefits at the same time as decreasing anxiety. And then finally, a more advanced breathing technique is called square breathing. This is the kind of breathing that you do in singing especially, sometimes in swimming, and those two applications involve the diaphragm in a very pronounced way and can really help you with relaxation effects very quickly. I teach a graduate level class, and one of the things that we were learning were evidence-based ways of decreasing anxiety. As graduate students, they often had anxiety, and so I taught them the square breathing, and we would get to the point at the end of the class where they would ask to start the class with square breathing because they were feeling anxious and they knew that that would help them. It is a helpful technique. So the first thing that we're going to do is to think of a square. A square has 4 sides, and there are 4 phases to square breathing. 2 of them are things that we hardly ever do. So in addition to breathing in and breathing out, as we were doing before, we're also going to introduce a hold at the end of each. So the idea is that you breathe in, then you hold, then you breathe out, then you hold. It's very difficult actually as you increase the count to do the hold because again, it's something that we're not used to doing, but it's the kind of thing that if you can do it, it will help you a lot with decreasing anxiety. So if we start with a count of 5, which is a lot, the way that you would do this is you would breathe in, 2, 3, 4, 5, hold, 2, 3, 4, 5, out, 2, 3, 4, 5, hold, 2, 3, 4, 5. And what you want to do is gradually increase, if you can, to 10 on a side, and try to do 5 repetitions of the square breathing at a time. It's actually fairly difficult to do, but if you can discipline yourself to do it several times a day, especially at times when you might be feeling anxious, you should begin to get some immediate relief from something that's fairly easy to do. So I hope that this consideration of anxiety and epilepsy, especially for children and youth with epilepsy, has been helpful to you. Remember that we talked a little bit about what anxiety is, how it might manifest itself generally in people, how you might see it in children and youth with epilepsy, some things that we would do about it potentially, including having a talk with your primary epilepsy provider and referral to a child psychiatrist for medication evaluation, possibly a referral to a cognitive behavior therapist for some behavioral techniques, doing a lot of coordination with your child's school and within your family. And then we talked about some special applications involving social media because it's something that increases anxiety for teens, and a couple of simple breathing techniques that you can go back and practice whenever you feel like they might be helpful. These are things that you can take with you and apply and ask your child to participate in with you. And I hope that that will be something that you can take with you and share with others, because these are simple ways to decrease anxiety. And then, of course, there are more in-depth things that we can do to address anxiety disorders. Thanks for your time.